Well, we're back with Dr. Pauling here, a dentist. Now, Dr. Pauling, tell me something. You know, people sometimes have missing teeth, a couple, 2, 3, whatever. And I'm actually now talking about teeth in the back, because when a tooth is missing in the front, well, it looks very ugly and we run to a dentist rather fast. But in the back, we don't seem to be running that fast to a dentist. We don't necessarily see an immediate effect of something bad happening. And yet, every dentist like you keeps telling us a missing tooth creates havoc, it's a problem, and you've got to fill it. Can you shed some light on this apparent discrepancy? We don't see anything bad happening, and yet you keep saying it isn't a good thing, gotta replace it. Please.
So with missing teeth in the back, the problem that you don't seem to notice is right away is that it can have a tremendous effect on your bite when you close down, and it can really throw things out of alignment. And if it's something that you don't want to do right away, it can be a lot more difficult to replace that tooth in the future, because the bite can change when there's spaces in the back.
And when you say bite, explain this thing bite a little bit. You know, you mean I can't bite my wife as heavy and as hard anymore as I bite her now? I mean, what's the deal? What's a bite?
The way your teeth meet together is actually a pretty dynamic thing. And the way your jaw moves when you chew and everything can be affected by leaving gaps in the back. And it can lead to problems with your jaw joint, and can make it more difficult in the future to resolve problems.
I see. So what you're saying is, it's like, let's say we compare it to a fence. If one fence post or ball is missing, the other one has a chance to keep moving and getting uneven. And now once number one, that looks ugly and also loses effectiveness one way or the other way.
Exactly.
And if you compare it to a machine with cogwheels, let's say a Swiss watch, which has cogwheels in it. Well, I don't know if they still do, but anyway, they used to for sure. Once day, and I can think with that, because that's, has been one of my professions, a mechanical machinery engineer. So when a cogwheel is out of alignment or has a wheel missing, it may run for a while, but eventually the machine will come to a grinding halt. It will all get, so to say, out of alignment. Is that what you're saying, what's going to happen in the mouth if there is a tooth missing?
Yeah, and you won't make all your other teeth fall out or anything that extreme, but it can make it, when your bite or your occlusion gets out of alignment, it can cause spacing in your front teeth, and it can cause a lot of different issues that just make it more work and more cost to fix, and it becomes a lot more complicated unless we just originally replace that missing tooth in the back.
Got it. So basically, whether it's a door hinge or whether it's whatever it is, when something is broken and you keep using it, yeah, it may last quite a while, but when it deteriorates, you probably, number one, you have some problems in between, and number two, in this case, it's certain veins. You might even start looking a little crooked, or the teeth start shifting a little bit, ever so slow, I suppose. So one notices only when it's pretty big, almost like a dimmer switch. Is that about how it will go about?
Yeah, that's about right. That it's not extreme and it's not immediate, but it does cause problems that are harder to fix in the future.
Yeah. Is it true that missing tooth is a cause, not the only cause, for the whole jaw getting so out of aligned that you have a problem which is called TMJ, and you've got to pronounce that word for me because I surely can't, and then you get headaches, shoulder pain, neck pain. Is it true that missing teeth could potentially cause that headache?
Yeah, the disorder is temporomandibular joint disorder, and it can be caused just from losing teeth that support the jaw when that tooth that supports the jaw is gone, it's going to affect the joint and where it rests and everything. And it can lead to that problem.
And, that's definitely a deterioration of lifestyle. I mean, who wants to run around with a neck pain? I mean, if you just sometimes, do something wrong to your neck and you have a stiff neck for a little bit, that's just not good. Lifestyle goes down, headaches. It just can be nice to concentrate at work, at home with the kids and whatever. And that is, I guess, the type of things you're talking about, which then is much, much more difficult to fix.
Definitely. Much more complicated and costly. Yeah,
you probably still need to fix the missing tooth in the first place, but then you have other things to fix as well.
Exactly right.
Okay.
And that's, something that's very important is preventative dentistry to prevent these bigger problems from happening.
An ounce of prevention is worth a pound of cure, or something like that, right?
Yes, exactly.
Well, all right. So here you have it. Very enlightening. Thank you very much. We'll talk a few more things.